Well, we know it can be hard for all of us to leave work at work sometimes, but when your job is caring for sick and injured children, it's not surprising that it would definitely influence your parenting style.
Exactly. Our Dr. Frank McGeorge joins us with a closer look at how it's affected one local doctor mom.
As ER doctors, we see a lot of injuries that could potentially have been prevented, and it definitely makes you more aware of everyday dangers, and that is especially true when it comes to our kids.
As the Division Director of Pediatric Emergency Medicine at Beaumont Royal Oak, Dr. Kelly Levasseur is ready to handle any emergency.
What I'm trained to do as a pediatric emergency medicine doctor is to think about the worst case situations.
But Levasseur is also a mom to 10-year-old Jack and 8-year-old Kate. She says her job has had an impact on her parenting from the very beginning.
I'm always thinking about what potentially could happen, and at the same time thinking accidents happen, and it's okay if something happens, and we can fix it.
Oh, this is perfect. No, that's good.
Levasseur says certain rules are non-negotiable.
My kids, when they're riding their bikes, when they're riding their scooters, they always have helmets on. They always have closed-toed shoes. And that's just because I've seen so many kids come in with, their toenails hanging off, or they've fallen and didn't have a helmet, and they hit their head on a rock or a tree.
Water safety is also key.
There's always someone that's watching them in the water, and if they're in, a lake, they have their life jackets on.
But trampolines are particularly tricky.
American Academy of Pediatrics says no trampolines, and it's hard for me to let my kids go on a trampoline. If they go, there's one child at a time, there's a netting around it, but even that isn't going to guarantee that they're not going to get injured in some way.
Jack and Kate understand why their mom is more strict than some other parents.
Because she's a doctor.
Because she's seen it happen all the time.
Levasseur is also concerned about kids' mental health.
I feel very, very strongly about this, that children should not have phones and access to social media until they're about 12 or 13. We have 8, 9, 10-year-olds now coming in saying that they are feeling sad, that they want to hurt themselves. It does seem like a lot of it's related to social media. And if we wait a little bit longer to introduce them to the social media, then they're more mature to handle it.
The no phone rule is the toughest, says Jack.
It's good, but I still don't like it.
Levasseur says it's important to keep the risks in perspective.
We have to have fun. We got to be outside. You have to play. You want the kids to be outside.
Her biggest piece of safety advice for today's parents?
Put your phone down more and pay attention to what your kids are doing, especially around water, playgrounds, because the more that you're watching what they're doing, the more you can intervene if you see something that's not going well.
Advice she follows herself, says Jack.
She's always watching us, and she always makes sure someone else is watching us and she's not watching us. Sometimes it gets irritating. Sometimes it's also good.
We asked Kate if she'll be as strict as her mom someday. She said yes.
Because I want to follow her and be like her.
Now that's an endorsement. Now Dr. Levasseur says she's also vigilant about sunscreen and sun shirts and using the appropriate car seats for your child's height and weight. Sensible advice that can really help protect your kids. Back to you.
I always wonder that about Frank McGeorge as a parent.
Sure,
As
and
a doctor, does it make it easier or harder? Do you know too much?
I think it's hard.